Introduction. Welcome, medical students, to today's lesson on the intricate relationship between endocrinology and the immune system. Endocrinology is the branch of medicine that focuses on the endocrine glands and the hormones they produce, while the immune system is responsible for defending our bodies against pathogens and maintaining homeostasis. In this comprehensive script, we will delve into various topics, including neuroimmune interactions, the influence of glucocorticoids, the thyroid-immune connection, hormonal control of cytokines, and the impact of hormones on autoimmune diseases. So, let's embark on this fascinating journey of exploring the complex interplay between the endocrine system and immunity. Neuroimmune interactions highlight the intricate crosstalk between the nervous system and immune system. The communication occurs bidirectionally, allowing both systems to influence each other's function. Neurons release neuropeptides, such as substance P and neuropeptide Y, which modulate immune responses. Additionally, immune cells, particularly microglia, have been implicated in neuroinflammation and neurodegenerative diseases. The study of neuroimmune interactions unravels the profound impact of our nervous system on immune responses and disease outcomes. Glucocorticoids, primarily cortisol in humans, play a pivotal role in regulating immune responses. These steroid hormones, synthesized and released by the adrenal glands in response to stress, exert both immunosuppressive and anti-inflammatory effects. Glucocorticoids inhibit pro-inflammatory cytokines and immune cell activation while promoting anti-inflammatory mediators. However, prolonged exposure to high levels of glucocorticoids can lead to immune suppression, increasing the susceptibility to infections and impairing wound healing. The thyroid-immune connection refers to the bidirectional relationship between the thyroid gland and the immune system. Thyroid hormones, including thyroxine, T4, and triiodothyronine, T3, regulate numerous immune functions. Thyroid hormones modulate immune cell development, proliferation, and cytokine production. Conversely, immune system dysregulation can lead to autoimmune thyroid diseases, such as Hashimoto's thyroiditis and Graves' disease. The intricate interplay between the thyroid gland and the immune system highlights the importance of maintaining thyroid hormone homeostasis for optimal immune function. Hormones, such as estrogen and testosterone, exert profound effects on immune responses. Estrogens have immunostimulatory effects, enhancing antibody production and immune cell activity, which may explain the higher incidence of autoimmune diseases in females. On the other hand, androgens, including testosterone, have immunosuppressive effects, dampening immune responses. The delicate balance between hormones is crucial for maintaining proper immune function and preventing dysregulation. Growth hormone, GH, influences immune responses by enhancing immune cell proliferation, cytokine production, and antibody-mediated immune reactions. GH deficiency may result in impaired immune function, leading to recurrent infections. Conversely, excessive GH levels, as seen in acromegaly, can lead to altered immune responses and autoimmune conditions. Understanding the role of GH in immune regulation provides insights into the pathophysiology of immune disorders. Stress, whether physical or psychological, significantly impacts the immune system. The stress response involves activation of the hypothalamic pituitary adrenal (HPA) axis, leading to the release of stress hormones, including cortisol. Acute stress can enhance immune responses, but chronic stress can lead to immunosuppression. Stress-induced immune dysregulation increases susceptibility to infections, impairs wound healing, and contributes to the development of autoimmune diseases. Recognizing the impact of stress on immunity is crucial in clinical practice and patient management. The HPA axis refers to the intricate interplay between the hypothalamus, pituitary gland, and adrenal glands. The hypothalamus releases corticotropin-releasing hormone, CRH, which stimulates the pituitary gland to secrete adrenocorticotropic hormone, ACTH. ACTH, in turn, stimulates the adrenal glands to release cortisol. Cortisol acts on various tissues, including immune cells, to modulate immune responses. Dysregulation of the HPA axis can lead to impaired immune function and contribute to the development of immune-related disorders. Insulin-like growth factor 1, IGF-1, primarily produced in the liver, is closely associated with growth hormone. IGF-1 plays a crucial role in immune regulation, particularly in cellular immunity. It enhances T-cell function, proliferation, and cytokine production. Deficiencies in IGF-1 can result in immune dysfunction, leading to increased susceptibility to infections and impaired wound healing. Understanding the role of IGF-1 in immune responses is vital in diagnosing and managing immune disorders. Cytokines, as molecular messengers of the immune system, play a vital role in coordinating immune responses. Hormones, such as glucocorticoids and sex steroids, exert control over cytokine production. Glucocorticoids dampen the production of pro-inflammatory cytokines, which contributes to their anti-inflammatory effects. Sex steroids, on the other hand, can modulate cytokine balance, influencing immune responses differently in males and females. Recognizing the hormonal control of cytokines helps unravel the complexity of immune regulation. Autoimmune diseases result from dysregulated immune responses targeting self-tissues. Dysregulation of the HPA axis, specifically cortisol dysregulation, has been implicated in the pathogenesis of autoimmune diseases. Alterations in cortisol levels, as well as defective negative feedback mechanisms, can contribute to immune system dysregulation and the development of autoimmune conditions. Understanding the link between HPA axis dysfunction and autoimmune diseases provides opportunities for therapeutic interventions. Autoimmune diseases exhibit a striking predilection for females, suggesting a significant role of gender in immune regulation. Sex hormones, particularly estrogens, have been implicated in the higher susceptibility of females to autoimmune diseases. Estrogens enhance immune responses, including B-cell activation and antibody production. Moreover, genetic factors, epigenetic modifications, and environmental influences also contribute to the gender bias observed in autoimmune diseases. Recognizing and addressing gender-specific factors in autoimmune diseases are essential for improving patient care. Hormone replacement therapy, HRT, has been widely used to manage menopausal symptoms in women. HRT, particularly estrogen replacement, can modulate immune responses in postmenopausal women. Estrogen replacement therapy has been shown to enhance immune function, reduce inflammatory markers, and potentially reduce the risk of autoimmune diseases. However, the effects of HRT on immunity are complex, and individualized approaches should be considered based on patient characteristics and risk-benefit analysis. In conclusion, the intricate relationship between endocrinology and the immune system highlights the remarkable complexity of human physiology. Neuroimmune interactions, the influence of glucocorticoids, the thyroid-immune connection, hormonal control of cytokines, and the impact of hormones on autoimmune diseases are just a few facets of this fascinating field. Understanding the interactions between the endocrine system and immunity is crucial for both diagnosing and managing various diseases. As future healthcare professionals, your comprehensive knowledge in endocrinology and its interactions with the immune system will undoubtedly contribute to better patient care and improved treatment strategies.